I would now like to take this opportunity for a Q&A, question and answer session that will end not later than 9 a.m. and last no longer than 30 minutes.
Step out and take a stand on this right now and say that you're willing to help people who are willing to pay for it, or is it just that we are not profitable and that your board members like Susan Bai cannot make a $30 million and you can't
Okay,
make
I think
$13
that
million
your question
because
is
we're
now
not profitable.
addressed.
People like myself.
Thank you for your question. I appreciate it. I have a question here. The man in the blue striped shirt.
Morning, my name is Bobby Jones, and I represent the bricklayers who have approximately 22,000 shares. Our company made a $10,000 contribution to Alex's annual meeting last year. This amount is not able to be publicly disclosed by WellPoint Shareholders. However, our company told ISS that it made no contributions to Alex this year, given that such contributions were no longer in line with the company's business strategy. But there was no commitment that our company would not provide contributions to Alex in the future. Alex has received much negative scrutiny, and a number of corporations have revoked their membership. Alex supports a number of policies that do not support the interests of our company and our fellow shareholders. Alex supports repealing the Affordable Care Act that would lead to loss in coverage for 2.5 million young adults who stay on their parents' health insurance until age 26, and 54 million people who have access to preventative care without copay, co-insurance, or deductibles. Also opposes efforts by states requiring employers to offer insurance to their employees and the repeal of federal health reform legislation requiring individuals to purchase coverage. These positions directly impact our company's profitability and it prevents future sales from being made. Shareholders would benefit from additional transparency around our company's contribution to ALEC and its rationale for the contributions. Other healthcare providers, such as the Blue Cross Blue Shield Association, have confirmed they are leaving ALEC. Will our company comment or commit to leave ALEC and no longer funding ALEC? And how is being involved with the group that writes laws allowing people to shoot others or pass anti-immigration laws help our company's business strategy?
Thank you for your question. We did not make a contribution to ALEC in 2012. We did in 2011 contribute to the ALEC, the American Legislative Exchange Council, to attend its annual meeting, where we did advocate that the council call on states to enact exchanges as spelled out in the Affordable Care Act. We were unsuccessful in our efforts as the council ultimately recommended that the states not implement exchanges. We, your company, WellPoint, engages on public policy issues that are core to our business and generally avoid engaging on issues that are not specifically related to our business. We work with members of government, others in the industry, the broader business community, our customers, and the general public to advocate public policies on health care and insurance-related issues that support our customers' interests and our business goals.
Will you commit now to no longer fund ALEC in the future, since it's contradictory to what you stand for? You didn't answer that.
We need to continue to have the flexibility to advocate on public policy issues, and we'll make those considerations very carefully. All right. Can we have another question, sir, in the blue shirt?
Hello, my name is Michael Torres. I'm 246 shares, and I have a question. Why is our company funding a tax on public employees? I am a public employee. In general and specifically, the right to collectively bargain when it's estimated that a third of WellPoint enrollment is from collective bargaining. Being WellPoint is our insurance provider, it would seem as though our premiums are being used to fund our own demise. I couldn't believe this, so as a typical library employee, I did some research and discovered that $95,000 plus was donated to Mitch Daniels. John Casey got $72,000. Scott Walker was supported by, we were the second highest donation next to the Koch brothers, and almost $1.3 million was given to Republican leadership in 2010 and 2011 to support these campaigns, as well as ALEC. which attacks the collective bargaining rights. So if a substantial portion of our company's customers are represented by collective bargaining, how is supporting these attacks good for our company? Isn't this a bad strategy?
Well, let me say we value each and every one of our customers. And on the issues and the way in which we choose to support candidates, as illustrated on WellPoint.com and our extensive reporting there, we engage on public policy issues with candidates that are on issues that are core to our business, so on the healthcare policy specifically related issues. And we generally avoid engaging with policy experts on issues that are not specifically related to our business.
So what healthcare policy were
Thank
you engaging with Scott Walker? That's what I want to know, and Mr. Daniel. What healthcare policy?
Ma'am, you're out of order.
Were you engaging with them on?
That is a great question.
Good question.
Woman in the purple, would you like to ask a question? Thank you. The purple, woman in the purple sweater up front.
Go get 'em.
I'm holding in my hand petitions that were signed by 15,000 American tax-paying people, middle-class people, union members, who you're working against by engaging in activities with the Koch brothers and by contributing to Alex. My question is, and I have 2,592 shares. My name is Suzanne Klein from Los Angeles, and I'm the co-chair of the Los Angeles County Employee Benefits Committee. We represent over 800,000 union members who have the choice to choose or not choose WellPoint services. And with collective bargaining issues involved in this, you're supporting people like Scott Walker in Wisconsin and other anti-worker situations throughout the United States and contributing $86 million to stop the Affordable Health Care Plan. I want to know how this is going to take WellPoint to the place that it's supposed to be as representing and being the company that we need for people's health care.
Thank you for your question.
I want to present this petition.
Thank you, and we'll have somebody from the security folks to collect that from you. Again, I want to reassure you that we engage on public policy issues that are core to our business, the healthcare policy issues. We generally do not engage on issues that are specifically not related to our business. So our focus is and will remain on the healthcare policy issues, and it is our goal and desire to serve members from a variety of segments and capabilities, and that is how we're going to continue to stay focused.